Thank you, Jose, and thank you, Joshua, for that inspiring story. The UCLA Center for World Health is pleased to join with Rotary LA5 in talking about planetary health. And I have to say, there is a connection. Los Angeles is part of the world, and in many ways reflects what's going on in the world. One can go from neighborhoods that are extremely rich, such as occur across the street from UCLA in Bel Air, down to South Central. And the disparity is enormous. That exists all over the world and is one of the issues in planetary health, because the people at the lower end of the socioeconomic scale are going to be the ones who suffer the most. It's my pleasure to introduce Professor Sir Andy Haines, former director of the London School of Hygiene and Tropical Medicine and the chairman of the Rockefeller Foundation Lancet Commission on Planetary Health. And he will talk to us about what planetary health is and what the global environmental challenges are. Please welcome him. Thank you.
Well, many thanks indeed, and it's an enormous pleasure and a privilege for me to say a few words today. I think it's particularly appropriate to be speaking to this audience of Rotarians because I'm very aware and appreciative of all the contributions you've made to global health through polio eradication, and also, of course, your unique blend, really, of local activities and global activities, your range of skills and talents, professional, entrepreneurial, and so on, make you really an ideal partner for work around planetary health. So let me just get my images up 1 second. Is that actually showing up? Oh, that's showing up, good. So I'm just going to give you a few headline messages from the report. The report itself is should be on your seat. It's quite a detailed report, so I'm not going to go into many of those details. But what I want to do is to get over the kind of essential issues that we raise. We're an international commission, commissioners coming from a range of different countries and disciplines, and we've been working together over the last year to synthesize a lot of complicated evidence. We were supported by the Rockefeller Foundation and gratefully acknowledge their support and championing of this cause. So we start off by looking at some of the global environmental changes and also the drivers of those. And what's really quite extraordinary is that we are transforming our planet in a way which has never happened before in human history. And this transformation is so marked that many scientists have said that we're moving into a new geological era called the Anthropocene. And it's called the Anthropocene because it's humans, our species, that are now dominating and driving environmental change. That's partly because of our lifestyles, of our aspirations, of our material consumption, and partly, of course, because of the burgeoning population, which will probably reach 10 billion by the end of the century, maybe more than that, and currently stands at around 7 billion. We've achieved remarkable things. Poverty has fallen, and extreme poverty has fallen, although inequalities have persisted. Life expectancy has gone up more than 20 years since 1950 or so. We have used vast amounts of energy, water use. We're approaching the limits of water exploitation in an increasing number of countries. And we've domesticated about 40% of the world's land. We've now reached a kind of plateau there. We can't actually exploit very much more, so we have to make better use of the land that we have. Water shortages, as you well know better than I do, are increasing. So increasing numbers of countries are going to experience extreme water shortages as years to come. And we're depleting tropical forests. Our oceans are acidifying as carbon dioxide dissolves in it. And we've already heard about climate change. We are headed, if we carry on emitting at the level we are headed to probably a 4-degree average global warming by the end of the century, which is something which I think is truly concerning. And biodiversity, we're losing biodiversity at a rate which is 100 times more than that in history. So what does this mean? I mean, is this just an environmental issue? Do we not need to get worried too much? After all, health is improving. Well, health is improving, but it's come at a price. And our concern is that we may have mortgaged the future. So we have achieved a great deal. We have benefited. Our health has improved. We've developed. but our concern is we maybe have mortgaged the future prospects for health of many people around the world. And if you're looking at those trends as a clinician, as a doctor, if that was a patient, you would say those trends are very extreme. Those are vital signs indicate that we are heading for an emergency. It may not be tomorrow, but it's going to be in years to come, decades to come, on planetary timescales. And those adverse effects are with us now and are probably gathering pace as we speak. So let me just give you a few headline messages. I mean, one, of course, of our big concerns was the food system. So we are trying to sustain a population now of 7 billion, with more than 10 billion probably to come. And we're facing a whole range of pressures on the food system: land degradation, soil erosion, water scarcity I've mentioned. Loss of pollinators, that's an interesting one. A paper that came out with our report in The Lancet by Sam Myers and colleagues from Harvard showed how pollinators are declining around the world. If you get a 50% pollinator loss, then that will have big effects on food production, particularly fruit, vegetables, nuts and seeds, and they are all important for human health. And he estimated that an additional 0.7 million people a year would die from conditions like heart disease and other diseases which are prevented by high consumption of fruit and vegetables. So pollinators can have all sorts of effect, or decline of pollinators. And it's not just the land, of course, it's also the oceans that are changing, and we are exploiting or overexploiting our fisheries. Water I've mentioned, and this slide just kind of summarizes, and you'll find more detailed evidence in the report, the potential changes in crop production towards the end of the century. The red areas are where you're going to get big declines in crop production as a result of decreased water availability, added on, of course, to climate change. And you can see that many parts of the world, including parts of the USA, are likely to experience further declines in crop production as a result of declining water availability. Air pollution we've already heard about. That's intrinsically related to environmental change. Ambient or environmental air pollution is largely related to the combustion of fossil fuels, so low carbon technologies can reduce our exposure to air pollution as well as reducing climate change. And of course, household air pollution kills over 4 million people. Any of you who've been into a house in a low-income country, the first thing that hits you is a level of pollution. It's extraordinary. The levels of inhalation of pollutants from mothers and children has a dramatic effect on their health and kills large numbers. So reducing that pollution by cleaner cook stoves, better energy, cleaner domestic energy is a big challenge for public health. We also talk about disasters, and we use the country of Pakistan as a kind of case study, if you like. Pakistan, one of our commissioners, the former Minister of Health, Dr. Nishtar, is launching our report in a few days in Pakistan. And it's already causing quite a stir in that country, because what we do is we point out the multiple pressures, really, on resources in Pakistan. The rising population, droughts and floods, the heat waves we've seen in the last few days, when over 1,000 people died, and that's an underestimate, due to unprecedented heat waves. And we're seeing a migration of the rural poor into cities to escape this extraordinary thermal stress. So a country like Pakistan, these multiple impacts really have potentially very worrying implications for civil society, for social cohesion, and perhaps for conflict. And then finally, we also outline the effect of environmental change on emerging diseases. As many of you know, many new diseases are arising, and some old diseases are re-emerging. And we document how this is happening, many of them related to environmental change, changes in food and agricultural systems, which bring human beings in close proximity to these often dangerous infectious agents, many of which are transmitted from animals. And this slide just summarizes some of the diseases that have emerged. So we outline the problems, and in concluding, I just want to touch very briefly on potential solutions, because I think it's important to emphasize that there are solutions, and if we work collaboratively together, we can advance those solutions. Some of those solutions are in the health sector, making more resilient health systems, for example, that can cope with emergencies, but many of them demand the kind of collaboration of the range of talent we have in this room. So we've already heard about sustainable cities. Sustainable cities are really crucial because all the population growth that's going to occur in the next decades is all going to be in cities because people are migrating in. from rural areas all around the world. And we've already heard there's a lot that can be done to reduce the resource consumption of cities, to make them more resilient, and to make them much healthier places. So active travel, over 3 million people die every year around the world just through lack of physical activity. Physical inactivity is a major risk factor for ill health. And really the only way to get it is not by going to the gym. It's not bad to go to the gym, but it's very difficult to sustain. So the way to get it is through our daily life, and through the kind of physical activities when we go to work, walking to work where we can, using public transport where we can. And that's a win-win situation. Reducing fine particulate air pollution, developing green spaces which can protect biodiversity, protect watersheds, and reduce the urban heat island, by the way. Promoting access to healthy food, which has a lower impact on the environment and is better for health. And creating increased resilience to floods. The global food system is a major challenge that we articulate in the paper, and we point to the fact that there are many strategies that could improve the availability of food, and we will have to improve the availability of food faster than we've ever done throughout the whole of history, because not only is the population increasing, people's demands are increasing. As they develop, they want to eat more animal products, and that's more difficult, has more pressures on the environment. So we need a whole range of different approaches. I don't have time to go into them, but we do articulate a whole range of approaches that can improve food availability and quality. And one of the things that really struck me, I hadn't realized, 30% of the world's land is, the food is actually wasted. So the land that is growing that food is actually, in a sense, redundant because it's producing food that will never be eaten. So just improving and reducing food waste is an important strategy. We also articulated how ecosystem strategies can increase disaster resilience. So we often think of, hard adaptations. We build a seawall, say. But actually we found that many of these ecosystem approaches, like supporting wetlands, many of which have been lost around the world, regrowing mangroves, for example, protecting coral reefs, can protect us against extreme events, floods, for example, tidal waves, and so on. And they're often cheaper than some of these engineered solutions. So we need to look at solutions which support ecosystems. Forestation, countering deforestation. We showed how many policies to reduce deforestation can also improve human health by reducing the transmission of diseases like malaria, but also reducing the burning of forests. And the burning of forests, the land use fires, kill over 300,000 people a year just from inhaling the smoke. And so we document how, by reducing those landscape fires, we could also improve human health. We also suggest that we need to think about a kind of transformative approach in our economy. We're far too wasteful at the moment. We could achieve a great deal more with less environmental disruption if we move towards what's been called a circular economy, where we have more remanufacturing, more recycling, much greater energy efficiency, much less residual waste. And if we design this properly, then we can improve human health, as well as offering tremendous opportunities for innovators, for entrepreneurs, to make money through this kind of innovative technology and reducing the waste in the system. So the challenges are indeed very great to humanity. Arguably, they're the greatest challenges that we have faced as a kind of species. On the other hand, we have unprecedented resources too. We have unprecedented technologies, knowledge, and we have the capacity to work together across disciplinary boundaries. So we end our report with very positive statements saying that solutions do lie within reach, and we need to redefine, really, our vision of prosperity, which is focused, or should be focused, on the enhancement of the quality of life, the delivery of improved health for all, together with respect for the integrity of natural systems, which ultimately our health and the health of our children, grandchildren, and future generation depends. And so we will need to work together across disciplines, across nations, in order to forge a future, a much more sustainable, cleaner future, which can safeguard the health of humanity and protect the natural systems on which we all depend. Thank you very much indeed.